Ranking Member Bost and members of the committee. Thank you so much for the opportunity to testify before you today during the House Veterans Affairs Committee's Member Day hearing. I'm not on the committee. I really just appreciate the opportunity to share with you Iowans' priorities when it comes to supporting our veterans. And Mr. Chair, I heard you mention obviously the veteran members. So I know Iowans are well represented with Dr. Miller-Meeks serving on this committee. But I just wanted to add a little bit to that conversation by sharing with you some of the stories that I've heard from here in Iowa's 1st Congressional District. Last week, I was honored that 2 of the bills that I helped introduce passed the House with overwhelming bipartisan support. One of those bills targets sexual harassment and assault within the Department of Veterans Affairs, so that VA employees have a safe work environment and can focus on their job of serving our veterans. I'd like to thank Congressman Pappas, who I saw on earlier, for co-introducing that and helping get that across the finish line. I'm confident that that bill will be considered by the Senate soon. And the other bill that I was proud to have passed the House last week was the Sergeant-Ketchum Rural Veterans Mental Health Act. As you know, Mr. Chairman, this bill was named after a veteran from here in Iowa who was denied that service at a local VA and tragically ended his life shortly after he was turned away. He had those war wounds that were not visible, and unfortunately he paid the price. I believe this bill is absolutely essential, and I thank the committee for helping to advance this critical legislation. But again, it's only the first step. I'm also here today to talk to you about veterans' access to care, specifically in rural areas. While all of our veterans need and deserve our support, especially when it comes to their mental health, this support can be extremely difficult to access for veterans in rural communities, like many of the communities that I represent. In rural communities, veterans often have to drive long distances, travel to major cities, which can be triggering on its own with bigger population densities and the stress that goes with that. They oftentimes have to take time off of work if they've re-entered the civilian sector, or wait weeks or months for care. And I'm not listing just the barriers to access. These are real barriers, real troubling challenges for veterans who are suffering from mental health challenges like depression, PTSD, anxiety, and more. It's hard enough for some of our veterans to make that decision to seek help, ask for that help. We don't need to make it any harder for them to actually get the help that they are seeking. I know this is an issue because one veteran in my district explained to me just how hard it is to make those decisions after experiencing combat trauma and PTSD, and just how hard it is to book an appointment, let alone leave the house and drive several hours to an appointment, sit in a waiting room surrounded by unfamiliar faces, on edge. We have to legislate with those veterans in mind. The ones who most need the support are the ones who have the hardest time getting it. So earlier this year, I had the privilege of visiting Retrieving Freedom in Waverly. It's a nonprofit. It's an organization dedicated to training service dogs for veterans, and they also help kids with autism. Service dogs are trained to meet the specific needs of an intended human partner. They're a true match. The dogs undergo a rigorous training program that lasts more than 2 years. They learn how to perform specific chores and tasks, but they also offer companionship and unconditional love, according to the organization. I can tell you from firsthand experience, I saw that companionship and unconditional love when I met Tracer and his human, Sergeant Trent Dirks. Sergeant Dirks served our country honorably in the U.S. Army, deploying to Afghanistan in 2010 and returning home to the U.S. after seeing the unimaginable horrors during his tour in Northeast Afghanistan. And upon his return to Iowa, Sergeant Dirks did struggle with PTSD, an inability to sleep, depression. He watched 2 friends with whom he was deployed take their own lives. He thought about it himself, and then he found Retrieving Freedom, where he was paired with Tracer. The story of a soldier who needed support and wasn't getting it elsewhere isn't new, unfortunately. What is new is the way that Tracer sat with his back up against Trent's legs when he told me this story, ensuring that his owner knew nobody could come up behind him. So I met Trent and Tracer after years of their journey together, after Tracer accompanied Trent to a veterans hospital to get intensive treatment, giving him the confidence to be in public. And according to Trent, Tracer has helped boost his spirits and return happiness to his life again. So Tracer goes home with Trent every night. They live together, they care for each other. He has that constant support system, and it means he can live his life again. So I encourage this committee to think about innovative solutions to the challenges our veterans face, especially in our rural communities. We have to support and encourage nonprofits like Retrieving Freedom to continue their incredible work. So I'd ask the committee work with me in this bipartisan way to support the increase to accessibility of service dogs like Tracer for our veterans. Thank you, and I'd welcome any questions from the committee. But again, Mr. Chair, thank you for the opportunity to speak today.
Thank you, Representative Hinson. Certainly, we appreciated your work on helping us get the legislation on sexual assault and expanding healthcare to rural veterans. And we know that there's tremendous support within the Congress on service dogs and access. And we just passed major legislation related to that as well. But we know that there's still more to go there. And we appreciate your interest and your commitment to veterans. And so thank you. Thank you for your presentation.